Hi, everybody, and thanks, Jay and AIOS. Going with the theme of PEDs and CSCR, I have a case whether they are dreaded PEDs, should we defend them or are they a dead end? I have no financial disclosure. So this is a 46-year-old gentleman, a very anxious patient, type 1, very aggressive and anxious. 6/6 vision at presentation with metamorphopsia for 3 months. This was in 2018. He had lost the other eye to an RD several years ago. So one-eyed patient here. So this is the images on first presentation. You can see hyperreflective material intraretinally and also in the dome of the PD. You can see thinning of the margins of the PD here, and also you can see some amount of hyperreflectivity. So the patient was just given a trial of epsineron for about 4 months, and there was no change in the morphology or in the symptoms here. You can see on sequential follow-up, there was absolutely no change. The patient was lost for follow-up for 2 years. He presented back with increasing metamorphopsia with 6/9 vision now. He had previously received 2 anti-VEGF elsewhere with no response. We saw here now that there was thinning of the PD at the margins and at the dome as well. There was also intraretinal and subretinal fluid which had now occurred, and there was also hypertransmission in the choroid, but there was actually no clear membrane that was picked up on the opta, and the patient was not very keen on undergoing an angiography at this time. So to do a quick comparison, this is the first picture when he presented, the fourth image, and the first, second, and third are current images that when he presented to us subsequently. So this is when we decided to inject the patient again. This was in September. We went ahead with a aflibercept at this point of time, and this is post the first and second injection. Not any major response as far as the intraretinal fluid or the PD goes, but the subretinal fluid did respond to some extent. And then subsequent injection did see a major improvement. So if you can see here, there was variable response to the first 2 aflibercept. SRF was the first one to respond. The IRF and the PD remained same. And the blowouts of the RPE was more defined as there was resolution. The patient then presented in March 2021. We did continue with the injection since the patient was symptomatic, and it was not given monthly as and when the patient came for a follow-up or was symptomatic is when we gave the injection. This was the last was in June, July when the patient came. And that was when we saw some amount of stabilization. Patient also was responsive and he was happy. He presented 2 months later with an injection-free period of 5 months. And this is in October 2021. You can see an early recurrence. And you can see that the PD is coming back and the hyperreflectivity or the transmission remains. So this is a patient with recurrent serous PD, metamorphopsia, and one-eyed. So my questions or discussion points are: what are the management options for serous foveal PDs with early symptoms? What works best for them? What is the role of epsineron? Of course, we didn't see any response here. Is aflibercept warranted? How do you manage recurrences? Because now this patient has come back with a recurrence, and pachyneovasculopathy. What are the options for treatment? Thank you.
Fantastic case, Chaitra, as usual. I'm sure Dr. Dhananjay Shukla is waiting to comment about the RP efforts.